Good evening. I'm Deja Perez, and I'd like to thank you for joining us for the policy landscape and what's at stake for Black communities and reproductive justice. I am joined by my special guests, Marcella Howell, President and CEO of In Our Own Voice, National Black Women's Reproductive Justice Agenda. Hi there. I think your mic might be muted.
Hello. I'm unmuted now.
Fantastic. Oh, I'm well. Thank you for joining us. Also, Dr. Jamila Burgess-Parrott, President and CEO, Physicians for Reproductive Health.
Hello. Thank you so much for having me.
Yes, thank you for joining us. Also, we have Marsha Jones, CEO and founder of the AFIA Center.
AFIA,
I apologize. The AFIA
okay.
Center. I'm so good at everyone else's. All right. Thank you.
Hello. Thank you all. Thank you for having me here.
Of course. Last but definitely not least, we have Charity Woods Barnes, co-founder and managing director for Interfaith Voices for Reproductive Justice.
Hello. Thank you so much for having me.
Hi, ladies. Thank you so much for taking time out of your day. This is an insurmountable topic that we need to talk about. It's so important for us as Black women, and I thank you for taking the time. It's super important, and I want to kind of dive in. First things first, I would like to start with some introductions so that people kind of have a better understanding of what your backgrounds are. So, Marcella, can you tell everyone about yourself, please?
About myself? Well, I am the president of In Our Own Voice, as you mentioned. I've been an activist for I won't even say how many years. Marsha was talking about her birthday. I had a birthday just last August, and turned past the 70 mark. So that's really a big fun thing for me. And I have a new grandson who is 5 months old and has already started to stand up because I haven't seen him yet, but I'm planning on going out to Oakland and visit in December. And then of course, my organization is an organization that works with Black women across the country. We are a national state partnership. Marsha, the AFIA Center, is one of the 8 organizations that are our partners. And we work on reproductive justice issues.
Perfect. And we are going to speak in depth about reproductive justice and reproductive justice issues. Dr. Parrott, can you please explain to everyone who you are?
Yeah, absolutely. Yes. So my name is Dr. Jamila Parrott. I am a board certified OBGYN with subspecialty training in complex family planning, and the president and CEO of Physicians for Reproductive Health. Physicians for Reproductive Health is a physician-led organization. We work to improve access to comprehensive reproductive health care for all people. And we do this by organizing and mobilizing medical providers, really leveraging education, advocacy, and strategic communications to ensure that the communities we care for have equitable access to comprehensive reproductive health care. Our network includes physicians of all specialties from across the country who are really committed to meeting the healthcare needs of their patients, because we believe that this work is necessary for all of the folks we care for to live freely with dignity, with safety, and with security.
Absolutely. Thank you so much. Miss Marsha, can you tell everyone about yourself?
There we go. I'm Marsha Jones again, and I am from Dallas. I've been an activist for a long time. I won't say way before I founded the AFIA Center, but it was a little bit before then. HIV brought me into this work. Just kind of watching what was happening inside of the communities of faith, because I felt like, I didn't think the communities of faith did a really good job with HIV back in the day. So that's kind of what brought me in. Never knew I would be working with Black women, and I realized later down the road that was an issue. And so I've been with the AFIA Center. I think we're 13 years old now. I actually co-founded it with Mukam Tagare, Jendaya, and the AFIA Center. We've been holding it down for Black women, unapologetically centering Black women in all of the spaces of our work, health, wealth, as well as finances.
Perfect. Thank you so much. And Miss Charity.
Yes, Charity Woods Barnes. I am a co-founder as well as president and CEO of Interfaith Voices for Reproductive Justice. We are about 3 going on 4 years old. We are a national reproductive justice organization that works at the intersection of reproductive justice and religion, a little bit different than faith. A lot of our work, for example, we work with religious scholars and womanist scholars. We center Black women and girls in our work, and we work across intersectional issues. One of the issues that we are working on is religious freedom, religious liberty, which is addressed in this policy agenda. So that is a chunk of our work. And as I said, we also work with Black women, religious scholars, theologians, and ethicists who really want to help change and shift the culture and the narrative around reproductive justice issues and Black women. And so we're really excited about that work that we're doing.
Thank you all for joining us. Before we actually kick things off, Ms. Marcella, if you could just explain to some of our viewers, in case they're not familiar with the term, what reproductive justice actually means. Oh, but you're muted. Sorry.
Okay, I'd be happy to. And of course, everybody on this panel can actually talk about reproductive justice. But it was a phrase that was coined by 12 Black women in 1994. They were at a meeting in Chicago, and they came up with the term because they were listening to people talk about pro-choice, anti-choice, terms that did not actually appeal to them. And they came up with reproductive justice by combining reproductive rights and social justice, and looked at it from the framework of how Black women actually deal with a number of issues that impact their reproductive health and rights. And it is grounded in a human rights framework. And it really is about the right to have a child, the right to not have a child, and the right to raise your children in a safe and healthy environment. It impacts everything about our lives. We don't live in siloed lives. And so it really is an intersectional approach that looks at all the kinds of things that impact how we make decisions in our own lives that can range anywhere from economic justice to environmental issues, to housing, to police, over-policing, to racism. It literally is looking at things from an intersectional perspective and basically asserting our human rights to make our own decisions for ourselves and our families.
Perfect. Thank you so much. Now, the U.S. has been experiencing a maternal health crisis for decades, and the rates, of course, are on the rise. Black women are nearly 4 times more likely than white women to die from pregnancy-related complications. Dr. Parrott, as a board-certified obstetrician and gynecologist, can you please share your observations on medical racism in the field and how that impacts access to safe and respectful care for Black moms?
Absolutely. You know, we're hearing a lot. Thankfully, we've had advocates and activists, Black women leading this work on the ground for many, many years to draw attention to that inequity that you named, right? The fact that I'm 3 to 4 times greater risk of dying during pregnancy or in the postpartum period than a white woman is. And the important piece about that, and I think that's embedded in your question, it isn't my Blackness that puts me at risk. Right? It is not something that is inherent in my skin that makes me higher risk. Black women are not broken and don't need to be fixed to be able to survive beyond pregnancy. And so when we think about the medical system in particular, I think it's important that we begin by acknowledging that medicine and science and the healthcare system is not somehow uniquely free from the legacies of racism and genocide and white supremacy that this country was built upon. The challenge is that we have not yet really begun to grapple with that in all the ways, not in medical education, not in our training, not in our research, none of the ways. You know, I loved Marcella's description of reproductive justice because it's something that was transformative for me when I learned that there was this framework, this theory, this ideology that 12 Black women created that spoke to what we deserved when we sought care. Now, it's not a healthcare delivery framework. I'm a doctor, right? We didn't learn about reproductive justice in medical school, not in my residency program, not in my fellowship. I was out in practice before I even knew that it was a thing. But it is so critical that we address it in how we are creating systems that allow us to be well in our own communities. So the short answer is that medicine isn't free from racism. It never has been, and our attempts to pretend that it is have really contributed to these inequitable outcomes for Black women during pregnancy and the postpartum period. And by really deeply understanding and grappling with that history, that legacy is the only way we can even think about moving forward to build communities where people don't just survive their pregnancy. We deserve to do more than survive our pregnancy, right? But to thrive, to raise our families in environments that are safe and sustainable and free from violence.
Absolutely. Does anyone else want to tackle that question?
I think Dr. Parrott said it all. I mean, I think it's she's been working with a number of people in Congress to really come up with some good policies. One of them is the Omnibus Act. I don't know if you want to talk a little bit more about the Omnibus Act, because it is a great piece of 12 pieces of legislation all wrapped into one. But it is something that addresses all of these systems.
So the tricky part about legislation, right? And so I'm a doctor, and so I take care of people. But it became very clear to me early on in my life. I grew up here in DC, and so it's hard to grow up in DC and not be touched by politics in some way, shape, or form. And even though I knew that I was going to be a doctor when I grew up, I also knew that there were forces outside of the clinical space that were going to impact my ability to care for my community. And so for me, that was a real direct line to policy. I just felt like I had to get to those folks. Maybe they didn't understand the way that they were creating policy and legislation and the harm that it was causing. And so the Omnibus Act is really, it's a Marcella said it perfectly. It's a package of bills that create systems and infrastructure and funding to ensure that our communities can be well by putting laws and policy and legislation in place. And so it's been championed by the Black Maternal Health Caucus. They're amazing Black women. Marcella is kind in saying that I have been working with them. I have been leaning deeply on Black women organizers and RJ organizations who have taught me a tremendous amount in how I can leverage the power that I have as a physician to be able to enter these spaces and to create paths for folks to design what health looks like for themselves.
Thank you for that. And Dr. Parrott, as a physician and advocate on sexual health, reproductive rights, and social justice, what do you think is the biggest threat facing Black women right now?
From what direction? I mean, there's so many threats, but I think that, as opposed to leaning into danger and harm, I think that we have an opportunity really to create narratives around strength and resilience, right? And I think that not lifting up those stories is a threat to us. By continuing to talk about the ways that we are ever suffering and are dying and are harmed, right? But there are Black women who, for centuries, and we are part of a legacy of Black women who have resisted and who have been well and who have thrived under really difficult circumstances. And I think we have to make sure that we're lifting up those stories of resilience and power alongside the concerns that we're naming, the real concerns about the risk and the harm. We also get to talk about joy and laughter and pleasure and love. That's part of it too.
Thank you so much. Does anyone else have a perspective about some of the biggest threats that Black women are currently facing? Okay, moving along. Miss Marcia, a Texas law known as SB 8, which bans abortion care after 6 weeks, went into effect this month. The law also allows ordinary people to sue anyone who doesn't abide by the ban. Many have described SB 8 as racist because of how it impacts Black women. How does this law affect Black women and gender expansive individuals?
So So there's so many ways that this law impact that particular group of people, but I'll start here. Whenever there's like any kind of disrupt in the medical care system for folk who are most marginalized, there's going to cause a great issue. I'm sorry, y'all. Something is flying in my face at this time, and so that's the one thing right there. Just that disruption. I don't care what that disruption is. I don't care if it's mental health. I don't care what kind of health. So when there has been a disruption in the healthcare system, it is going to automatically impact those who's hurt the most from the beginning. So the people who have the least access to those things, right? But then when we look at that law, when we look at it, is forcing folk who can be poor, who are more likely to be poor, who are more likely to have the least amount of access to health care, who are more likely going to be working jobs that are essential to us living, but not enough for them to live off of what they make from those jobs, who are living in communities that they're tormented by environmental injustices. When all of these things are happening to them at the same time that you are denying them a fundamental right to have a medical procedure done to them, then it is going to impact them greatly. And it is just like a domino effect. And so you are essentially saying we're going to force people into carrying children, carrying a full-term pregnancy that they did not plan to do when there's a way to have this done, and you refuse to allow that to them. Because you see, white women have always had access to this, right? This is not, they've always had access. And so it gets to be this very single issue thing for them, when for us, it is not a single issue thing. Every time Black and brown girls are forced to have or have unintentional pregnancies, we create generational poverty. That is an issue that don't happen when white women are forced into going into an unintentional pregnancy. They don't even do a study on it because they know it's not an issue, you know. And so also there's this whole level of stigma and shame that continue to be perpetuated against Black women when we make whatever reproductive choices that we choose to make
with our own body.
With our own bodies. And then we to even think about the idea of this, and I'm saying not just the entire spectrum of what women look like, not having bodily autonomy. So when we're talking about the spectrum of that and how that don't just impact Black women who would be pregnant or want to be pregnant, but what about the entire spectrum of all Black women? We are forcing folk to be pregnant who know everything in their body and their mind tell them that they are not supposed to be pregnant. And what is the impact of that going to be on their mental health 9 months later, even if they make it to the 9 months, right? Because we also don't have mental health in our community. We don't have access to mental health in our community. So what does that do to gender non-binary folks? What does that do to trans folk that we're going to now force them into carrying? And then we're saying, oh yeah, you've got to carry this child, but we don't have Medicaid for you. See, the data says that 1 year Medicaid expansion would decrease maternal mortality, but we're not going to give you that in Texas. We're just going to give you another 4 months. We're going to give you 6 months. So we're going to see you after drowning. No, you need a 12-foot rope in order to swim, but we don't want nobody to say we didn't give you a rope. So we're going to send you a 6-foot rope. You're still going to drown because the 6 feet won't get you to the shore. And so it is that too. And so we know that Black women are still dying from maternal mortality, a higher risk of dying in the state of Texas. So you don't give us health care, you don't expand Medicaid, you don't make provisions for our mental health, you don't even make provisions for us to have a paying job. You continue to force us to live in places where it is environmentally unsafe for the children that you're trying to make us bring to this country. But you do increase the wages for policemen so that they can continue to do the things that they do that continue to harm us. So all of these things happen at the same time, and that is how these things impact us. We don't have the option of doing this in a single way because our lives are not single issue. That's my favorite speaker there. I mean, she's gone, RJWOA, but that's any email you get from me, that's at the bottom of it. We don't have that luxury. We don't have that. So that's how it impacts us. And so we have to tell this in a way. And as I'm happy for the work that women, Black women leaders, the national leaders have did to force this conversation, because usually when we have abortion stuff that happens in Texas, maybe I may get to talk about it 1 or 2 times, because this is what I talk about, and this is not what people want to hear. So they don't want to hear that. And so now I'm tired of talking to people. I've had to talk so much. So thank you all so much for making this happen. But this is the story that we have to tell, because the impact is great on us. And yeah.
Absolutely. And I appreciate your passion through all of it and keeping things in Texas, because the Texas state legislature also just passed a sweeping voter suppression law that was signed by Governor Abbott, known as SB1. You, of course, Marcella, have publicly stated that this is a targeted attack on Black women. How so?
Well, it's, this is Texas, and Marcia, most really bad policy gets started in Texas. And we've seen, the targeted attempts to attack basic reproductive rights and health. And now you also see this attempt to roll back Black women's access to abortion health and Black women's access to the ballot. The politicians that, have passed this really terrible voter suppression law they're trying to advance white supremacist concepts. And the only way they can do that is to control our bodies and prevent us to essential health care and to control our access to vote them out of office. And that's what they're doing. That's why we see SB1, which basically is just in a line of other voter suppression laws that have been passed. But what this one does, and it's also comes from that racist past, it basically says that we want to ban drive-through voting, which was extremely important during the pandemic. We want to put restrictions on early voting hours, including a ban on 24-hour voting. We want to ban mail-in ballot applications. And of course, again, they just made the voter ID requirements even worse. And they want to essentially keep Black women from helping other Black women in terms of voting. So what you've got this law that now says, all right, we're not going to allow you to vote us out of office because we want to pass all these really oppressive bills that will impact your community, but we want to stop you from voting as well. And the reality is that, as I said, this is Texas, and the assaults keep coming, not just from Texas, but from other places. These political assaults just keep coming. And we've seen voter suppression. We've seen attacks on abortion access. We've seen the kind of issues that they know that Black women will fight on. And we know that that's going to happen. And yet conservative Republicans in these states are passing these horrendous laws that basically impact on our freedoms.
Wow. Okay. So, Ms. Marcella, can you also, I think you've touched on this, but so the Black reproductive justice policy agenda, how do you feel like this kind of tackles some of the issues you were talking about?
Well, too often policies are formulated and written into law without a full understanding of how these policies can impact the everyday lives of real people. Mm-hmm. And the Black reproductive justice policy agenda presents this proactive policy solutions grounded in human rights framework, which is why it is the reproductive justice policy agenda.
Okay.
Which we believe will provide a clearer view of the needs of Black communities across this country. It's a first of its kind. We were able to bring together 30 Black women's organizations and reproductive justice advocates to work for over 8 months to formulate this policy agenda. It's a comprehensive document that includes 25 different reproductive justice policy issues and recommendations. And the document was written with a focus on Congress and trying to change policies and try to sort of wake up members of Congress to put an RJ lens on the policies that they are trying to create. And we think, and the Omnibus bill that we mentioned earlier and that Dr. Parrott talked about is included in that. What's also included is the John Lewis Voting Rights Advancement Act, which would restore the protections that the original Voting Rights Act had in it until the Supreme Court rolled back a lot of those rulings in Shelby County versus Holder in 2013, where they basically cut out the pre-clearance piece, which said that states that had a history of discriminating against Black voters could not pass onerous voter suppression laws without it going through the Justice Department.
Wow.
And the Supreme Court rolled that back because they felt like Chief Justice Roberts said, well, that was old and we don't have to do that anymore because these laws don't exist anymore. Well, I don't know what world he was living in when he made that statement, but the laws clearly did.
The white world. That's the world.
Yes.
It was the white world he lives in.
Exactly. He was living in the white world, sitting up there in the white building called the Supreme Court. And it was clear that those laws, that ruling gave all these conservative state legislatures the impetus they needed to pass more suppressive laws. And that's what we're seeing. And then, of course, the 2020 election, which changed the White House, and then later in 2021 changed the U.S. Senate in Georgia, also then sparked all of these conservatives to once again try to pass all these suppressive laws. And so that's what we're seeing here today. And, and the policy agenda presents policy solutions with the reproductive justice lens that right now is for Congress, but that what we hope our main vision is to take that policy agenda and take it to the states, especially southern states, where we can try and change some of the state legislatures that currently exist, put more people, more Black state legislators in there, more progressive state legislators into those state legislatures to eventually change some of those laws and take back those states for the people who live in them.
Gotcha. Thank you so much for that. Ms. Chair, so the policy agenda has an entire section that is dedicated to religion and reproductive justice. Can you please share how those two are connected?
So, the use of religion basically as a weapon to oppress people and marginalize people is nothing new. I think we're all somewhat familiar with that. But what we're seeing now, and particularly we saw under the last administration, is this heightened sort of proliferation of these policies, particularly on a state level, that really, in the name of supposed religious freedom and liberty, have been used to harm and oppress folks, women of color, people of color, poor people, LGBTQ folks, you name it, right? And we've seen this not just, we hear a lot about direct reproductive issues and abortion, but it goes beyond that. And what we're also seeing is the coming to fruition of a strategy that was put in place like decades ago, right? So when we started doing some work about 4 or 5 years ago and looking at the Congressional Prayer Caucus, because there was this Congressional Prayer Caucus, very conservative, they had put together this project called Project Blitz. They had this super organized playbook on how to create resolutions and policy templates that went across the board. I mean, everything from prayer in schools and limiting, folks' rights across the board. And that was so, it was so interesting to look at how organized they were. So what we know is that right now, what we're seeing is that this is harming us on other levels outside of like just our reproductive health. We know there are issues, for example, potentially around housing and discrimination against unwed mothers, right? That's a major issue. We know, for example, we talk a lot in this work about Catholic hospitals. I think it's something like 6 in 10 beds are in Catholic hospitals, and a lot of them are in poor and minority communities, right? So if they're denying certain aspects of the full spectrum of women's reproductive health and health services, that's a problem, right? So but at the same time, we have to understand that they are providing some health care in our communities, right? So it can be very complicated. So what we wanted to do, this is just sort of the beginning of these conversations and how we can start pulling back the layers outside of what we've sort of heard around. For example, it used to be LGBTQ, gay marriage and abortion and that sort of thing, but we know it's much more complicated than that. So what we're doing is just trying to educate folks, educate Black women to understand how these policies that are rooted in this oppressive religious theory and also white supremacy, let's be clear, are so harmful.
Thank you for that. So in fact, a survey conducted by the Pew Research Center found that Black Americans are more religious than the American public overall. 64% of Black women who participated in the survey said religion was an important aspect of their lives. Charity, how can Black women of faith become more involved in these issues and the reproductive justice movement?
I think a lot of times when we do talk about faith, religion, and progressive issues, when we do talk about them, right? Because we have an issue about talking about religion and faith oftentimes. But someone, for example, like me, I've born, raised, and done all my work in the South. Any progressive work, democratic work, political work that I have done, there's no way I could do it without engaging faith and religious communities. Black faith and religious communities, right? It is so very important. So while we have a lot of work to do in our religious communities, we know Black women are very faithful, spiritual, religious. They are the backbone of the Black church. So it's a very nuanced situation because it's also been a source. It's been a source of oppression, but also great liberation, right? It's just like when Dr. Parrott was talking about how we talk about oppression, but we've also got to talk about the resistance and resiliency. And so even in times when we have not heard or seen our lives and lived experiences reflected from the pulpit and in our faith and religious communities, we've always been there, right? We've always pushed for our own moral and bodily autonomy. And so we have that history. And so we have such an important role to play and to push and to open up these conversations. I think it was Marsha who said something about how this issue has related to white women or been related to white women versus Black women. We have to talk about other issues. We don't talk about just that issue of abortion because it's so much more than that. We have to talk about economics. We have to talk about education. We have to talk about our environment. And so because all of that is connected in here, right? So it's so important that we are telling our stories and that we are taking the initiative and controlling our narrative and speaking up for ourselves as well, and that we're not getting lost because we have our own set of circumstances. And so it's important for us to push and use our voice and educate ourselves around this and to use our influence and power to shape the conversation.
Absolutely. Thank you so much for that.
Can I add one more thing? We do a lot of polling of Black women. And what we have found when we have asked Black women about access to abortion or the ability to control their own body, and we also ask them questions about how they self-identify as being very religious, what we have found is that everyone will say that we support the right to have an abortion. We support having a provider in the community. We support having our health insurance cover the full range of reproductive health services, including abortion. And those who self-identify as being very religious also say that. So even though Black community is very religious, it's a foundation, but it is a foundation that also embraces bodily autonomy, that says, I have a right to make these decisions that I think are best for myself and for my family. And we in some of our polling asked the question about birth control, abortion, and if your minister says he is opposed to those things, what do you do? And the answer is always, it's about my body. And yes, I am a practicing Christian, but it's about my body. And that is very clear. It is Black women have this vision of their own self that is religious, a parent, a sister, a family member. As Marcia said, we don't live in these little silos. And so we always take all of those issues to heart and how we view the world. And that's the vision.
And I think
can I just one other thing to add to that? Even if you look at the data around who has abortion, there is no difference in rates of abortion for people who identify as religious or not, right? Highly religious people, Catholics, have abortions at the same rates that non-Catholics do, right? And when you look at folks, and even if you're thinking about the demographic makeup, right? Race, economics, income, levels of poverty, we see that Black women are overrepresented in folks that are needing abortion care. So are folks living on lower incomes, right? Also overrepresented in those needing abortion care. And so when we're talking about these intersecting issues, it's all of the systems that come together to make it more likely for you to be pregnant when you don't want to be, and to need access to abortion. And those are the same ones that won't support you should you carry this pregnancy to term. There are no social supports in our community. You cannot feed your kids healthy food, no clean water to drink, right? And so really focusing on simply the legal right to access abortion is not enough, because there are all of these other factors that go into the decision-making process. The last thing that I'll say too is that, you know, the majority of folks who have abortions also are parents. So they know what it's like to parent. And so this idea, right? This idea that folks are making these, you know, I don't know whatever the stigma that they want to attach to folks seeking abortion care at the current time is, right? That they have no idea and aren't exercising agency and autonomy is simply untrue. And so there's so much work to do to really dispel those myths and that stigma so that we can do exactly what Charity says. We have to tell our own stories, because those stories will always be complicated and they'll always be intersectional.
And to Dr. Parrott's point, you know, I'm sorry, just that quick. I lost my train of thought, y'all. All right, I'm sorry. That means I couldn't have said it any better, Dr. Parrott.
But you know, I did want to say, I want to say something as it relates to that. I wanted to go back to what Marcella was talking about earlier, about the impact, if it's okay for me to go back there, the impact of this as it relates to Senate Bill 1 with those voter suppression laws. One of the things I think that is important to know, and this is something even that white women can understand, that when we make those decisions to vote the way we vote, we don't always get what we want, right? And so this stuff come back and it hunt us. And so when you deny folk who, when you deny the most marginalized folk from voting, then you don't get enough votes to put the people in office who would potentially vote for the rights that all of the people need. And so we wind up with these same people in office who continually chip away at our rights on every level, because we're not making the connection of our reproductive rights and our voting rights. They're all the same thing. Like, you can't divide it, and so they are intentional in making sure that the people who really need and should be voting the most will have the most complicated time voting. And they also bank on the fact that a lot of times people may feel like, well, I've been voting all of my life. I saw my mother vote. I saw my grandmother vote, and nothing changed for me. So I'm not going to vote, and I'm definitely not going to make that special effort to vote, right? So since you took that away from me, I'm not going to vote. They know,
or fight for the right.
They know it, and they bank on that. And so we must continue to drive home all oppressive systems work the same. Voter oppression, reproductive oppression, human rights violations, all of this stuff lead to the same outcome. And so making that connection, just like we have to make that connection in our communities of faith, we have to make those connections in our communities of faith. We have to make that connection at the poll. We have to make it after they get in office, because it is literally the same system that's putting us where we are today. So whenever we talk about it, I just try to make it one story. You cannot talk about one without the other.
Right, absolutely. And thank you guys for your comments in the chat. I promise I will get to your comments as soon as we wrap up. But lastly, Ms. Marcella, this week kicks off In Our Own Voices, 7th Annual Reproductive Justice Week of Action. What is the Week of Action, and how can our viewers get involved?
Well, first of all, they can go to our website at www.blackrj.org. And you can find the Reproductive Justice Week of Action. It is our 7th annual Black Reproductive Justice Week of Action. It is what we're doing is we're trying to mobilize people around the Black RJ policy agenda to urge members of Congress to implement policies to help liberate Black women, girls, femmes, and gender expansive people. But we're not just waiting on Congress. We basically are doing a lot of different things. Today was our kickoff day. Tomorrow we're doing a panel, a congressional briefing on why Black moms need the Omnibus and postpartum Medicaid coverage now. And that's going to be really important. We're going to have remarks by Congresswoman Lauren Underwood, who is a champion of the Omnibus. On Wednesday, we're going to look at what's going on in the states, reproductive justice in the states. And we're going to have 2 different panels. One that's called Beyond Binaries, Building State Movements for LGBTQ plus Liberation. That's at 12 o'clock. And you can register and come on to that panel. It's going to be fascinating. And then at 6 o'clock, we have a panel called Decriminalizing Blackness, Dismantling Systems That Punish Our Bodies, which can be about almost anything. In terms, we're going to have our state partners on talking about that as well. Thursday, we're looking specifically at voter suppression and what's going on. Voter suppression is called Voter Suppression is Repro Oppression, Building Power Against State Attacks on Voting Rights and Reproductive Justice. That starts at 1 o'clock. And again, we're going to have some of our partner organizations. We're going to be looking at a group that we work with called the State Innovative Structures that basically, it's called 6 actually. And they reach out to state legislatures. And we're going to have a big discussion about voter suppression and reproductive rights oppression. And then on Friday, we're going to have a whole Instagram live that's called The Future of Reproductive Justice, Activism on HBCU Campuses. And of course, the HBCU campuses, historically Black campuses and universities, we have a fellowship program, a 2-year fellowship program that basically hires people, young students from these HBCU campuses to work with us on policy issues on their campus. They do a number of things. They are absolutely wonderful fellows. They have been with us. This is their 2nd year. And so it's called the Next Generation Leadership Institute. They will be on talking about what they're doing on their campuses. And so that's going to be our show for the week. And as I said, this is our 7th Black Reproductive Justice Week of Action. We're really excited about it. It's got a lot of good stuff in it. And I want to add one more thing, that one of the programs that we have that reaches out to Black women voters, because, you know, Black women voters are the most progressive voters in America. We vote for reproductive justice, for reproductive health. We vote for workers' rights. We vote for things that basically change systems, not just what will change somebody's individual life, but change systems. And that's really what our program is about. But it is designed to not just have Black women voters turn out for congressional races and presidential races. The I Am a Voter program is designed to get them to mobilize, to vote in state legislative races, mayoral races, city council races, things within their state that impact their particular lives. Because it's not enough to change what Congress does. We've got to change what's going on in the states, because that's where, as Marsha said about Texas, and you know, and Texas is a bellwether state. They get things passed in Texas that then go to all these other states and get replicated. And that's why it's always so important to challenge Texas in what they do. And we saw in Georgia earlier this year, Georgians turned out and changed the United States Senate in a runoff elections, which very rarely happens, but we did. Black women came out, mobilized with Latinas, API women, and really changed what the US Senate looks like now. And that's what we're going to have to do state by state.
Absolutely. Thank you so much. I don't mean to rush you by any means, but I know we only have a few minutes left and we have a couple questions that I wanted to make sure we got answered. There's a question from YouTube. How can we use, and I believe Ms. Marcella, you might have touched on this, but how can we use the polling data to help further our cause and shape our narrative as RJ advocates?
Well, maybe Marsha, you want to answer some of that? You do polling.
How do you use the polling data to further the cause? So one of the things you have to do is take the polling data to the community, right? Use that polling data as your expert, so that you can debunk those myths that you hear. We started using that polling data about 3 or 4 years ago, and it totally changed the game for the Afia Center. It changed the game on how we were approaching conversations that were specifically happening in communities of faith. When we were able to use this polling data and say to faith leaders, no, this is what your people are saying. Faith leaders started to change their mind a little bit. As a matter of fact, my pastor's now on my board. You know, they started to change. People started to call us. They wanted us to use this. Marcella told you, almost for a year, they wanted us everywhere in the state of Texas providing them with this information. So find the place that you hold the most of affluence, and even if it's your family, and start having conversations about it. Have meetings about it. Have community conversations. People want to hear it. So many people feel the way. They know they feel that way, but they didn't know that other people in their communities and other people in their communities of faith in different spaces felt that way. So it's very important. I can go on and on about that polling data. It changed everything for us.
Gotcha. Thank you for that. There's another question from Michelle Batchelor on Facebook. What is the impact of lack of or restricted access to abortion health care has on Black women and pregnant people?
So, you know, the restricted, I'll start with that if that's okay.
Sure.
So the restricted access to abortion care, there's actually really robust data around what happens when folks who are seeking abortions are unable to get them. And there are a number of things that play out, right? So one, for folks who are seeking abortion care and are denied, then they are more likely to be bound or tied to a partner who is violent, to remain in relationships that they're experiencing interpersonal violence. They're more likely to experience or remain in poverty, more likely to experience economic and mental health distress later in life, right? So just imagine someone has identified for themselves, this is not what I can do now for whatever reason. And then, as Marcia described, are forced then to carry this pregnancy, and then also don't have the social supports that they need to survive and to thrive beyond it. So the health outcomes are really clear when abortion access is restricted. The other thing that I think it's important to really center in this is that what we're doing is stripping people of their agency and autonomy, right? And what that actually looks like in our lives. You know, the United States has a really long history of attempts to control what those with the ability to reproduce can and cannot do with their bodies. And this legacy of restricting reproductive autonomy dates back to enslavement, right? And the way that the reproductive autonomy of enslaved people was controlled. This is not a new thing for the United States. It is a long legacy. This is the newest iteration of it. And unless we really understand it within the larger historical context of the way that white supremacy shows up in our systems, then we don't have any shot at addressing it. This is more of the same.
Wow. Thank you so much. Ladies, would anyone else like to chime in on that? I mean, Dr. Parrott did amazing. Okay, so I wanted to ask where the audience can find more information on each of your organizations. I think what you guys individually and collectively are doing helps push the needle so much further, and we need this as Black women. And I want to make sure that people have access to you guys. So we'll start with you, Ms. Marcella. How can people get in contact with you or your organization so they can help support the cause?
Well, as I said earlier, they can visit our website, blackrj.org. They can sign up to get our alerts and our newsletters. And we have a whole section on there about becoming an activist. They can help if they have resources they want to donate to the organization. During last year's COVID pandemic, we actually distributed money to our partner organizations to help people in their communities who had been laid off. And we thought that was a really good thing to do because at that point, Trump was still in office and the federal government wasn't doing their part.
Right.
And so we felt that we had to do something because people were starving, basically. So you can come onto our website, sign up, and you can get involved in our RJ Week of Action, which is RJ, the initials WOA 21, and sign up for that as well.
Okay, Ms. Charity.
So our website is IV4RJ.org, and that's also for all of our social media. And that's our handle. And you can find the agenda and other information online. I do want to encourage folks, when you access the agenda, all of our websites should have the agenda up there, to definitely read over and sit with that beginning part a bit too. That we were so grateful to have one of the founding mothers, Dr. Tony Bond, really ground us at the beginning of that document and the history that Dr. Parrott referenced. And it really just it's a really good grounding. So I encourage people to read about that, and also how reproductive justice was informed by Black feminist theory and thought as well.
Thank you for that. Miss Marcia.
So all of our social media handles, everything is the Afia Center, and also our website, theafiacenter.org. You can find us anywhere on there. If check back periodically, definitely sign up for our newsletter, because that's how you know where we are, what we're doing, and how you can assist us. definitely start going, sign up now, because we will be putting out, we do a biannual State of Black Women in Texas. And so that biannual will be coming out probably over the next 2 to 3 weeks. And if you've ever seen one of ours and you like really loved it, nothing compares to the one we have this year. It is absolutely amazing. The State of Black Women in Texas. And also, we will be rolling out an all hands on deck campaign in the next week or so on how people can share and work with the Afia Center and help us as we continue to help the community at large. Thanks to the money we got from the funds we got from Marcella, we were able to assist so many families, and we did so in a way that we continue to do it. And so we are still doing that now. And so, we sent tons of stuff to the Haitian refugees in Houston on yesterday. So that's how you can reach out to us. Remember, we real Black down there in Texas. And there's not a lot of folk that look like us, and we don't always get those dollars that other people get.
That part. And you know what? Miss Latasha D. Mays says, yes, Marsha, we love you. And the Black RJ movement is so grateful for your leadership in Texas.
I love Tasha.
So here for that. Dr. Parrott, I actually have one more question for you before we get your contact info. It was from Facebook, and I apologize for not mentioning this earlier, but someone asked, how do we create that balance between telling the stories that Dr. Parrott discussed, the positive ones, while making people aware of the gravity of the issues that Black women face?
We have an opportunity to do both. You know, the single narratives that you hear are because we aren't the ones that are telling the stories. We aren't the ones that are crafting it. When you are discussing issues that are specific to Black women, there should be Black women at the table discussing them, writing the stories, telling our own stories. That way that you always have that complicated view. We're never going to tell a single story. As Marsha quoted that Audre Lorde quote that I love as well, right? There are no single issue struggles because we don't live single issue lives, right? So we're going to tell the story in its completion. And so the benefit of having Black women talk about Black women is that you get both sides of it each and every time. And that's critical.
Thank you. And how can people get more information on you?
Yes. So Physicians for Reproductive Health, prh.org is our website. You can follow us on all the social media platforms at PRH Docs, DOCS, PRH Docs on Twitter, Instagram, all the social media places, and you can follow us there. If you go to the website, there are tons of resources as well. Most recently, we put out a reporter guide for when you're writing about abortion, ways to write about abortion in ways that don't deepen and worsen and expand stigma. So lots of resources for healthcare providers, for reporters, for writers, and lots of partnerships with other folks. So we're excited. Come check us out.
Thank you so much. I have actually one question. This might be for you, Dr. Parrott, but why is it, and generally as Black women, when we have an issue with fibroids and we go see the doctor, why is the first thing they want to take all of our lady bits out? Like hysterectomy is the first thing you say, kind of regardless of the age.
So Deja, you can't ask that at the last 1 minute of the thing. That's wrong. So it goes back to how little we know about issues that are specifically impacting Black women. Black women are more likely to experience fibroids than white women. And the issues that white women have is centered in the research, right? And so there are lots of ways that we know how to care for white women. And then that data is just like, that, put on Black women and said, well, we'll deal with it this way, right? So that's one reason, right? We have not had the same commitment and investment in research and scholarship around issues that are specific to Black women. The second is again, we got to keep in mind this legacy of eugenic policies, of stratified reproduction that undergirds the medical system. And so, when we're talking about thinking back to eugenics policies and practices, our fertility has never been valued in the same way. So it's not as, it doesn't feel like a big deal to take out our uterus because there's this myth. Of course it is, right? But there's a myth of hyperfertility of Black women, right? And so because our fertility is devalued, we're more likely to experience aggressive surgeries that will remove our fertility. right? So there's that. And then the last piece that I'll say about that is that, you know, the tough part about being a Black woman in this system that isn't designed to care for us is that the power dynamic is so great, it's hard to advocate for yourself in these systems. And so the work that we do at PRH, the work that I do as a Black OBGYN, is to really address the systems that are disempowering the people that we care for, right? As a way to really shift the power back to where it belongs, to the Black women that we're taking care of. And so this is really an undoing that has to be done. It's not, we cannot retrofit this broken system and expect that it's going to care for us. We need a new system that is built centering those that are most likely to be marginalized from care. And that is almost always Black women. And that begins from research, scholarship, clinical care, all across the board, right?
Absolutely. So I'll be coming to talk to you on a later note because we need to talk more about that. But I know I have to go. Miss Marcella, Dr. Parrott, Miss Charity, Miss Marsha, thank you all so much for joining us, for taking your time to share your knowledge, and so we can again move this needle forward. Everybody that is watching right now, if you for whatever reason missed anything, you will be able to view this, but also you can get more details at blackrj.org as well. So I thank you all again for joining us, and thank you for the time and sharing your knowledge with all of us. Thank you all for everything.
Thank
and
you.
Please let me know if there's anything I can do to help.
Thank you, Dee.